Doing well. I'm Dr. Milind. So recently, NEETPG 2024 results were out, and after the results, there are a lot of questions that are in the minds of the aspirant. And one of the problem that all are facing, and one of the question that is troubling the most, is choosing the path ahead. That how should I go ahead with the branch, and how should I come to the conclusion that I want to pursue this branch in my life? Should I pursue the passion that I want, or should I compromise? So I'm making this small video just to help you with that. Now, this question is often like once you get the rank, this question is going to trouble you that what branch actually suits me the most. So I just want to tell you first that our curriculum is such that after MBBS you have internship, and during internship you are actually rotated through all the branches. One of the reason is you get idea of all the branches, so you can pursue that in the future. But trust me, limited the internship has a very limited exposure to the branch, and it actually gives you a completely different perspective about the branch. Because as an intern, actually you're not responsible for a lot of things. You just see a part of it. So that is why it's become very difficult, during internship to actually get to know the branches. Also in India, it's the passion never, is the deciding factor, but the rank. So unfortunately, the passion takes the backseat, and as you will start pursuing the branch, you will realize that things are practically completely different. The thoughts, the ideas that you had about the particular branch are actually not there in the reality. So one by one I'll be just talking about these branches which will help you. First, the question branch versus colleges. I think a lot of students have asked me, sir, I'm getting the branch of my choice in periphery, and I'm getting different branch in a very good college like in the top colleges of the state. What should I go for? See, I have always advocated that a branch is something that you should always go for. One of the main reason is college is going to stay with you only for 3 years, and training of your branch is only not for 3 years. You are actually going to train your branch for the rest of your life. Every day you will learn something. And what I believe that even if you're getting branch in not so good college, you can complete your MD and residency there. After that, you can always do a senior residency in a college of your choice. For example, if you get suppose in a peripheral college of India, let's say in somewhere in UP or Bihar, somewhere a peripheral college where you want to pursue, or in Maharashtra in a very peripheral, you're getting MD medicine. But after that, you can go to Mumbai, you can go to Delhi and do senior residency in a top college in medicine, and it's not tough to get. And you can spend 1 year or 1.5 year to, if you feel that you have some deficiencies to to recover them. So I think that is always a good idea. And don't get tempted by the college name. For example, I have seen some people say that, sir, I'm getting, I want surgery, I'm getting surgery in some peripheries, but I'm getting ENT or ophtha or community medicine in MAMC, and I want to go and study in MAMC. But I feel, MAMC is going to stay with you only for 3 years, and branch really matters. But when it comes to the non-clinical branch, then I want to just say that you have to be a little bit cautious. Like if you want to pursue branch like pathology, microbiology, community medicine, then I think you should be careful about the choosing the college as well. Because when you choose a good college, like for example, if you take a community medicine in AIMS New Delhi, or let's say microbiology or pathology in AIMS New Delhi, so it actually will give you a very different career, perspective. Because I have seen, people who go there, they get exposed to a lot of different things. Like people doing community medicine end up working for WHO. So I think when you pursue a non-clinical branch, I think this is where you have to be careful with the college, that the opportunity that it is going to offer you in the future. Also, if you look at the current scenario, like while choosing a branch, we should also be aware of कि अभी तक अभी situation क्या है. See, first of all, metro cities are saturated. No branch is spared. All branches. Think about medicine, pediatrics, ENT surgery, radio. There's a lot of saturation because after getting a seat, like if you feel like after doing your MD, when you want to settle down, you feel like metro cities do justice to your talent, and you'll get a good pay and good quality of life. That is why every doctor is migrating there, and that is why metro cities are already saturated. Also, there is a growing competition among the specialties, and there is an unseen competition as well. And when I say unseen, I mean there are people like from the other allied practices, that non allopathic, like BMS, PHMS. So they are also kind of giving you competition in this state. Also, there after COVID, a lot of small nursing homes have been collapsing, and there are a lot of private players, big hospitals. Actually, they are setting the tone, and that is why doing a personal and a private practice is becoming increasingly difficult. Also, nowadays patient have a very unreal expectations from the doctor, because there are so many to choose from. So there is a lot of doctor shopping that happens, and because of that also there is increased patient doctor conflict that we are seeing nowadays. So while choosing a branch, definitely one all because this is a time that is going to shape your life forward. So it is very obvious that all the thoughts are going to come to your mind. So I'm just going to share my experiences. So I have completed my MBBS, then I did my internship, and then I did my post graduation, and then 3 years of my senior residency. I have also worked in a private medical college for a while. I have done 5 to 6 months my private practice also in between. I have studied in a institute also. I have studied in a private. I have got exposure of the private system as well, and I have a lot of people and lot of through my channel, like I am interacting with a lot of students, and the people who have already established, like professor, assistant professor, I have a lot of conversation with them. So whatever experience I have regarding all these branches, I'm going to share with you my viewpoint. So first, the branches that we are going to talk about is the premium club. There are two branches that everybody usually want to go for, is radiology and dermatology. So first, they are obviously the decorated branches. So I just want to tell you that definitely these branches have a very good prospectus when it comes to money, especially radiology. Like radiologists, when you work in a metro city, you will make a very good money, and you'll have a good work and life balance. Also, if you're someone who want to avoid this patient doctor conflict, then definitely you don't want that patient contact, then again this branch is something that will give you what I have seen in radiology also. See, no branch is stress free, to be honest. In radiology also there are a lot of litigation issues, and you have to be very careful while reporting things, because there are a lot of, I have seen a lot of people, if you do something, like while reporting, you should be very attentive, and there is a risk involved there also. I mean, it's not like the money that you should only see. So if you feel that radiology is completely chill, I have seen my radiologist friend even working on Saturdays, Sundays, and that happens because with the money comes the responsibilities and that work. But definitely, if you compare to other branches, the work, the amount of work that you have to do and the amount of money that you learn, radiology has the best ratio, that you get the best money, I think, there. But again, the limited, as I said, there are limited seats in India. You need a very top rank, and also the city will require a particular amount of radiology. So there is a very competition when it comes to the finding a job. Also, when you talk about the government setup, usually people do not opt for radiology in government. So because in government setup, you get a very less package, and I think private practice is a preferred practice by the radiologist. And if I talk about the clinical exposure, a lot of students, they say that they want to have this art of diagnosis, and they want to be interacted with the patients, and making the diagnosis, and following up the patient till the end. So they feel bored in radiology, but then again, that is a very individual decision. And I feel, if you are interested enough, you can always follow the patient even if you are a radiologist, because I had a friends who are radiologists. They would call and ask about what happened to that patient, what you did, and what was your next plan of management. So that is there, but definitely that the clinical part is definitely missing when it comes to radiology. Now dermatology, again, a very good branch, and my wife is dermatologist, so I have seen the life of dermatologist in front of my eyes. And definitely they don't have a lot of, they don't have night duties, and the life is quite chill, and they have a good work and life balance. When it comes to money, see, dermatology money is mainly concentrated toward the cosmetology part. So if you're someone who wants to do the clinical dermatology and more into academics, then definitely you might struggle at some point. But at the end of day, you have to go for, I think, cosmetology, and if you want to make a good money. Again, dermatologists are also, there is a difficulty in finding a job, because once you are, because again, there are very limited jobs. There are, like when it comes to senior residency vacancy or a job vacancy, you will see that dermatologists, they don't need a lot of dermatologists. So when you are after MD, you have to either start your center, or you have to get attached to the known center. So there is some struggle with the jobs that happens when it comes to the dermatology. And I think dermatology, as compared to radiology, will give you some clinical exposure, and definitely it is the branch, it's a very good branch, and if you want to pursue, then you can have that money, work, and life balance plus clinical. So everything is offered by this branch. So that is my take on these two branches. Now I will talk about the everyone's favorite, the big five, that is medicine, surgery, pediatrics, orthopedics, and obsgyny. Usually most of the students are inclined toward these branches. So I'll first talk about the common things about all these branches. So mainly, that whoever loves treating the patients and the arts of the clinical diagnosis and all, these people are very happy with these branches. So I'll just tell you one after another, some pros and some cons. So when it comes to medicine, so first of all, again, the medicine is our evergreen branch. I mean, there's nothing in medicine that everybody wants to pursue medicine, and definitely we all need, there's no dearth of work when it comes to medicine. You have a lot of jobs, and people, as we are the most populous country in the world, so you will always have your patients. Only thing is, in medicine nowadays there's a trend of super specialty, and I don't think that I don't see that as a problem, because there are a lot of seats available, for even your super specialty. So I think this is one of the good branch, and if you want to go for medicine, it's a very good branch. And medicine is also a branch where you don't have to worry too much about the college, because the kind of exposure in India, even if you get at the periphery, it's the same. So college actually usually does not matter much when it comes to medicine. Now about surgery, yes, for surgery is also again similarly like medicine, the branch which has now evolved into super specialty, and super specialty has become must for surgery as well. And again, there is a abundance of seats that you see, and I think nowadays it's easy to get into NEETSS. And surgery again, the glory of, it's a very glorified branch, and that, when you call yourself a surgeon, that's very, a very different feeling, and for some students are very particular about that. And I think it's a very good branch when it comes to surgery. Definitely there is a stress in the initial period of the residency. There are long hours, you never know when the surgical emergency will come. So definitely during the initial period you might have some load, but as you progress in the seniority, the things gets better. And once you become an established surgeon, then you can choose the timing of your surgery. And I think out of this 5 medicine surgery also, they make a very decent money, and you can do well if you take these branches. Similarly, orthopedics again a branch that is thriving well, and orthopedics is also a good branch. And nowadays we are seeing a lot of girls, and they're choosing orthopedics, and exploring this field. This will also give a very good money, and I think it's a very good branch. Obsgyny and orthopedics are similar, kind of. I feel, like when it comes to money and the kind of hard work that is required. Obsgyny is again a very demanding branch. A lot of girls, and now we are seeing a lot of boys also taking obsgyny as for the super specialty. Now with that, with the people are starting, opening the infertility clinics and all. So that is also added things that we're seeing in obsgyny. And I think obsgyny is also, I feel, only thing about obsgyny is it's very demanding branch. You need to do a lot of hard work. The residency is definitely one of the hardest among these all 5. And but if you are passionate about it, this branch will always give a good amount of money and a good fame to you. Now, lastly, I'll talk about the pediatrics, the branch that I have also done. I think the pediatrics is also a very beautiful branch, and it's different from medicine. And as of now, I feel there is no must need of doing a super specialty in pediatrics. Even if you are MD pediatrics, that is fine. There are a lot of fellowships courses which you can do. There are pediatrics is also a very demanding branch, because in medicine, you can leave the things on intern, that okay, you see the ward, you can do these things in my absence. In pediatrics, you have to be on the floor 24/7. Even you are senior resident, you have to be there in the hospital. I think that is something that is different about pediatrics. Also in pediatrics, you don't get that recognition, because you are not going to treat a very high five person. Like in medicine, you might someday treat the prime minister or chief minister or any important person. In surgery, you might operate any such person and do a life-saving surgery. In pediatrics, usually, we are dealing mostly with the children, so at times it gets challenging. But what I feel find most satisfying about the pediatrics is, the children respond way better than adults, and they are literally, you know, uh, it is magical when it comes to pediatrics. There are a lot of miracles that happen in pediatrics. So that gives one of the most satisfying branch. Although the stress is there, but it is very satisfying branch. If you compare all these 5 branches, I think pediatrics, if it when it comes to money, definitely you can earning money is again it's like a person's talent, and it will come down to the individual person. But if you compare the financial monetary prospectus of all these branches, I think pediatrics is the weakest one among all these 5. Now when I talk about the other branches, I'll call that people choose them either for a passion, or sometimes uh, as a compromise. I'm not saying they're bad branches. As I have said in the beginning of my video, in India, the passion takes the back seat and the rank takes the front seat. I had a friend who was way more, he was so much passionate about the anesthesia, but he got ranked within 1,000, and he took, I think orthopedics. So this is something that, because with the rank, not only sometimes have to compromise, but sometimes it will spoil you as well. So I think anesthesia is one of the underrated branch, but nowadays it's gaining a lot of popularity. And anesthesia, earlier it was mostly about the sedation, but now it has taken over the critical care. And I think that is the reason why anesthesia, I think, has a very good job prospectus. you can run the private ICUs, and you can get a very good package if you're a DM in critical care. This branch, you can pursue this branch after anesthesia, and I think that gives you a very good prospectus as a monetary prospectus also, and you get a very good reputation as well. Ophthalmology, again, another evergreen branch, but definitely ophthalmology and ENT again are saturating in metro cities. But again, ENT and ophthalmology are, they give you a satisfaction of being a surgeon as well, and they are less demanding as compared to the other surgical branches, and you can choose your workload in that as well. But definitely there is a problem with the saturation that is these branches are specifically facing. Lastly, I'll talk about the psychiatry. Psychiatry is again the branch that not a lot of people have as their first choice. But if you look at the current world, psychiatry is the current need of the time, because we all there are so many stress factors that are there faced by a lot of people, and they're looking for a person to who would guide them in that situation. And now people, now we are making therapy as a normal part of life, and I think psychiatrists are thriving very good, especially in the metro cities, and they're doing good. And I think this is a branch you can definitely look for. Now, a lot of people who feel like they don't have a decent rank and wants to have a work life balance, they usually go for these non-clinical branches like pathology, micropharma, biochemistry, physioanatomy, forensic medicine. And usually when they're going for these branches, I think their main thing that they think about is a work life balance. Definitely there is a lack of recognition, I mean, when you go in society, when you try to meet the society standards, society definitions of a doctor or a clinician, definitely you feel like you are lacking there. But I think if you want to, there are two things you can do. One is definitely when you pursue these branches that are going to give you a work life balance. But one thing that can help you, because my where I did my MD, my director of my institute was MD in microbiology. So if you are even doing MD in these branches, you can actually be the drive forces behind all the clinical decisions that are being done in the taken in the hospital. You can actually shape the policy of the institution, and you can actually grow in the administrative part. So even I feel that even if you are not happy, and if you feel like, okay, maybe I'm not able to do my passion, or I'm not able to impart that change that I want to convey in the society or have that impact in the society. I think I have seen a lot of directors and these administrative posts are being actually run very nicely by specialists from these branches. So this is something that actually you can think of when you are taking these branches. Lastly, there are some lesser known branches. I have put interviews on my channel about a lot of these branches, and I will bring more people from these branches to guide you further. So branches like blood transfusion medicine, radiotherapy, nuclear medicine, geriatric medicine. So geriatric medicine is a branch for the people who are above 6 years old, like pediatrics below 18 in government, and less than like 13, 14 years we take in a private. Geriatric is more than 60. Then you have emergency medicine, another emerging and amazing branch. There is a branch called infectious diseases. There are branches like pulmonary medicine, TB and chest medicine, sport medicine, and MD in hospital administration. So what is common about these branches is definitely they are opening the new horizon. And but the problem is, apart from emergency medicine, most of these branches are actually thriving well in the metro cities like nuclear medicine and radiotherapy. We are going to need that proper infrastructure to run that. Also, like branches like blood and transfusion medicine, there is a problem in the finding a job and progressing further in the career. Emergency medicine is definitely a emerging branch, but I feel that most of these branches, the career opportunity is as of now mainly in the either in the institutes as a professor, or as working in the same department, or in the metro cities where you can get the job. Sports medicine is also something unique that I have seen few people pursuing it. This is also something that you can always take into consideration while choosing a branch. So lastly, just I want to summarize and give my opinion. So once my senior told me, when I was confused about taking a branch, he said, to survive, my first branch of choice was medicine. So he said, to survive in any branch, you need at least this one out of these three. Either you should have a passion for the branch, either you should have a college or tag, like you're doing it from the aims, so you feel like, or a MMC or a college tag that you are happy and proud to carry around, or you should have an environment or colleagues which make you stay in that branch pleasurable, or you feel like you belong there. So if you can find any one of three in that branch, I feel that you can pursue that branch. If you don't have any of these three there, then it will be difficult for you to continue in that branch, and this is something that I think you should take into consideration. But what I also did when I chose pediatrics, I was also very scared to pursue this branch, but I thought, okay, I will face it with a positive mindset, and I think that is what helped me the most. The When you talk to a radiologist who is an established radiologist, the radiologist who is doing his MD, and the radiologist who is already on the verge of retiring, you will find that everybody has a different opinion. So I would feel, don't let it strongly affect your choice. It should be your choice what branch you want to choose at the end. And lastly, don't start with the luggage in your head. Whatever branch you want to start, medicine, surgery, pediatrics, radioderma, don't start with the luggage that these branches like this. Face it with the clear mind, and I think your journey will be smooth. So I think this was a very long video, but I just wanted to convey all my thoughts in the this video. So I hope this video helps you in some way. I wish you all the best and take care.